Hospital helicopters like the one behind me here at Cox and similar equipment at Mercy are critical for people in medical emergencies, but those in rural Missouri are facing a shortage of access to air ambulances.
Frankly, the rural citizens of Missouri should not continue to see the access to care denied.
That's Seth Myers, president of Air Evac Life Team, a Missouri-based air ambulance service. The problem, says Myers, payments for services don't keep up with provider costs. But unlike other expenses, patients don't have much of a choice. In the majority of cases, air ambulance transport is at a physician's or paramedic's request, and air ambulance access is critical. 85 million Americans living in rural areas need air transport to get to a trauma center within an hour of injury. Myers says insurance companies, including Medicare and Medicaid, don't always pay what the ambulance companies say they need to cover costs, leading the provider to send bills directly to patients. And patients, especially those covered by private insurance in rural areas, aren't always able to pay. This balanced billing practice now has Congress's attention, with the Senate considering a bill to cap the amount a provider can charge to patients.
We want to work directly with insurance companies and also preserve the ability to get a fair payment from insurance to continue to provide this access to rural citizens.
So what's fair? A 2017 Government Accountability Office assessment found air ambulance costs increased by triple digits between 2010 and 2014. The cost of providing air ambulance services, while high, are generally fixed because the provider needs to be ready for action 24 hours a day, 7 days a week, with a full crew of pilots, nurses, and mechanics. Here's a cost breakdown from a 2017 industry report looking at a different sample of ambulance providers. The median cost per flight was $10,199, with insurance, payroll, supplies all fixed, and fuel and aircraft maintenance cost variable. The political solution to this problem is also variable, with the Senate tabling further consideration of the balanced billing legislation until next month. Missouri Senator Roy Blunt told us, quote, "I'm continuing to look at this issue and hope we'll be able to find a solution that addresses air ambulance accessibility and affordability. If not, access for rural Missourians to this critical medical service will be left up in the air." Brian Calfano, Ozarks First.